$25,000 was the very first amount we ever got. I will say that the state health department, through federal funds, Thrive Alabama receives nearly $2 million a year.
Okay.
Now in funding. Our funding is very broad because, and this kind of gets into why we became Thrive and why we are where we are today. It was very difficult to increase our funding. When I started out, we had 198 clients, and we have between 1,050 patients at any one given time who are living with HIV today. So with no new money, you had what you had when we had 198 clients. Now we have 10 times that, and there's no new funding. So what do? So what I did, with the help of my amazing staff, we wrote grants. And today we operate on about 30 grants, and there are a wide range of services such as mental health, behavioral health. We now take care of people, babies all the way up to the elderly, who are not infected with HIV. We have federal funding called Federally Qualified Health Center, or CHC, Community Health Center. We are the safety net. There's 1,400 of us around the country. And here in Alabama, we have 19 federally qualified health centers. We are taking care of people that no one else wants to take care of. Very similar to where we started out with HIV and AIDS. So people who have insurance, who can't find, and we'll talk more about this, who can't find a provider. We have people who are on Medicare. We have people that are on Medicaid. And then we have the people who don't have any insurance whatsoever and who either go without or they show up in the emergency rooms here in our city. And that kind of care is not... My granddaughter, a couple of weeks ago, had a breathing emergency. She needed to be in the emergency room. Some went to the emergency room in an ambulance. People who are there for a sore throat should not, or a cold, should not be at the emergency room. Right. They should be seeing their primary care physician.